Now more than ever, we need to find balance in order to deal with these uncertain times and function at our best. Mental health and wellness is relevant to every single one of us, and I'm a firm believer that the tools from the field of psychiatry can benefit everyone. In this video, I'm going to be breaking down top 5 myths about psychiatry and introducing you to a new paradigm in the field of mental health so that you can optimize your well-being. I'm Dr. Nishi Bhopal. I'm a physician specializing in psychiatry, sleep medicine, and integrative holistic medicine, and it has become my mission to empower you with the best tools from modern science and ancient wisdom to sleep better, achieve optimal well-being, and function at your best. Myth number 1, psychiatrists are drug dealers and will force you to take medications. This is simply not true. A psychiatrist is a physician and should do a thorough assessment to see what your needs might be. Psychiatrists can offer everything from talk therapy to working on coping skills to doing a full medical assessment to see if there are any root causes for your symptoms. In my practice, I use an integrative approach. So I draw upon principles from Ayurveda, which is the ancient system of medicine from India, to integrative and holistic medicine. I use a lot of supplements and nutrition and yoga and meditation techniques. I do a lot of testing to look for the root cause. And in fact, I actually help a lot of my patients get off medication. Myth number 2, only crazy people see psychiatrists. While there are some conditions that can be severely disabling, many people, in fact, most people who see a psychiatrist do not have a severe disabling mental illness. In fact, in my practice, many of my patients are high-functioning professionals who are looking for additional support through a difficult time, or they're looking for that root cause analysis that I was just talking about to see if there are other conditions that could be contributing to feelings of anxiety or feelings of depression, feelings that many of us experience that sometimes can become overwhelming where we need additional support. Myth number 3, psychiatrists classify normal emotions as mental illness and are always diagnosing you. We're all human and it is normal to have a wide range of emotions. Sometimes these emotions can be overwhelming and debilitating and can affect our day-to-day experience of life. Sometimes we get caught up in negative emotional or behavioral patterns that can affect our experience of life. Your psychiatrist should be able to help you determine if and how more support could be helpful. Myth number 4, it takes too much time to see a psychiatrist, or once you get started, you have to continue seeing them forever. While there are some people who do benefit from the long-term care and support of a psychiatrist, many people are able to see a psychiatrist for short-term support and graduate from treatment. It doesn't have to take that much time out of your day to see a psychiatrist. Now, especially with everything happening with COVID, telemedicine sessions, telepsychiatry sessions are much more accessible. And I see a lot of my patients on video where they don't have to take any extra time out of their day to get to the office and find parking and, take time off of work. It's become pretty seamless now with video sessions and doesn't have to take a lot of time. Myth number 5, psychiatrists are not physicians. Well, in fact, psychiatrists are doctors who went to medical school for 4 years and then additional residency training for 4 years after that. And some of us even went on and did more subspecialty training. For example, I did another year of sleep medicine training. And then many of us go on to do additional training even after that. So, for example, I also did some training in Ayurveda and in integrative psychiatry, which is a whole new paradigm in psychiatry that we'll be talking about in a moment. So what is this integrative psychiatry? Integrative psychiatry is a really exciting new field within the field of psychiatry. So integrative psychiatry is just that. It integrates the best of modern psychiatry and modern medicine with ancient practices like those from Chinese medicine and Ayurveda. And it's all about getting to the root cause of some of these symptoms that we can find disabling. So it involves doing testing of metabolism and of the gut and the gut-brain axis and the microbiome. It also takes a trauma-informed approach and understanding how different experiences have informed how we go through life now. It also involves bringing in principles of yoga and meditation and other holistic practices that are really, really healing so that you can function optimally and that you can feel at your best and move through life with ease. Every week, I'm going to be breaking down science from integrative psychiatry into bite-sized, digestible, easy to understand pieces that you can use in your everyday life to improve your sleep, which is one of my specialties and areas of fascination, and to improve your performance and to improve your overall well-being so that you can just function at your best. If there are any specific topics that you want to dive into, please let me know in the comments below. I've also created a free guide on holistic ways to improve sleep. The link to the guide is in the description below.